Administering GLP-1 injections like semaglutide or tirzepatide at home is a very straightforward process once you have the right supplies and knowledge. One aspect of ensuring the effectiveness of your injection is choosing the correct needle size. This guide will help you understand the factors involved in selecting the best needle size for your semaglutide or tirzepatide injections. Needle size is determined by two key factors. Number one is gauge. The gauge of a needle refers to its thickness, indicated by a number followed by a G. Example, 25 G is 25 gauge. A higher gauge number means a smaller, thinner needle, while a lower gauge number means a big, fat, thicker needle. For example, a 30 gauge needle is thinner than a 25 gauge needle. The thickness affects how easily the medication flows and the comfort level during injection. The second part is needle length. Needle length is measured in inches and determines how deep the needle goes into your skin or muscle. For subcutaneous injections, which are administered just under the skin like any GLP-1s, shorter needles are typically used. The length you need depends on factors like the injection site and your body composition. However, 99.9% of patients will have simple insulin needles, which are 29 to 31 gauge needles at 1/4 to 3/8 inch long. Semaglutide, tirzepatide, and other GLP-1 injections are typically administered subcutaneously, meaning the medication is injected into the fatty tissue just beneath the skin. Compared to intramuscular injections, subcutaneous injections are short, thin needles. For subcutaneous injections like semaglutide and tirzepatide, like I said, the common needle gauge ranges from 29 to 32, and the length is usually between 5/32 or ½ inch, very short and small. Always consult with your healthcare provider for choosing the best needle size for your treatments. When you come to Genesis Lifestyle Medicine, we will provide you the needles that you need in order for you to use the medication properly. Your healthcare provider should always consider factors such as your body size and composition. Larger individuals or those with more subcutaneous fat may require longer needles to ensure the medication reaches the fatty tissue. If you have had previous injection experience or discomfort or issues with past injections, your provider can also suggest adjustments in the needle size, or if you have specific medication requirements. So the viscosity and dose of semaglutide, tirzepatide might also influence the ideal needle size. While your provider is always your best resource for personalized advice on needle size, there are some general guidelines you can follow to help select the appropriate needle size. Number one, use the smallest gauge possible. Opt for the smallest gauge needle because that can effectively administer your medication with the least amount of pain. Thinner needles or higher gauge are less painful and cause less tissue damage. So gauges between 29 to 32 are usually suitable for any GLP-1. Secondly, choose the right length. For subcutaneous injections, a needle length between 4 millimeters and 12 millimeters is sufficient. Shorter needles are generally adequate for 99% of adults and help reduce the risk of injecting into the muscle. However, if you have more subcutaneous fat, you might need a slightly longer needle of 8 millimeters to 12 millimeters, but that is extremely, extremely rare. Always practice proper injection technique, regardless of the needle size, because that is crucial for the effective administration of GLP-1s. As always, we can teach you that, but some general guidelines are cleaning the injection site first. Use an alcohol wipe to clean the area to reduce the risk of infection. Number two is pinching the skin. Pinching the skin can help create a thick layer of subcutaneous tissue, making it easier to inject the medication into the right layer. Number three, always inject at the right angle. For subcutaneous injections, insert the needle at a 45-degree angle or as recommended by your healthcare provider, directly in and directly out. Always properly dispose your needles afterwards. You can use a dedicated sharps container or any hard plastic container, such as a bottle or something like that, to put your needles in. Never dispose of needles in a regular trash to avoid injury and contamination. Here are some tips to alleviate that Anxiety you get about these needles. Many people experience anxiety with it. So, choosing the right needle size and practicing good technique can significantly reduce these feelings. You can use numbing creams or ice, although with subcutaneous injections, once you do it once, you'll realize, wow, that was nothing. There's no pain, no discomfort. So, always discuss with us or your healthcare provider of how to do this. Make sure you relax and breathe. Take deep breaths. Try to relax. Tension can increase discomfort, so staying calm is beneficial. Rotate injection sites. So, rotating sites can prevent soreness and tissue damage. Use different areas of your body, such as the abdomen, upper thighs, upper arms, to administer your semaglutide injections. And always select the best needle size for your semaglutide or tirzepatide injections. We, again, can help you, or your medical provider can help you in getting the smallest needle that is effective. If you have other concerns, please always contact your healthcare provider, or at Genesis Lifestyle Medicine, our providers can offer detailed instructions to help you understand how to best self-administer semaglutide, tirzepatide, or any GLP-1 injection for optimal comfort and effectiveness. As always, thank you for watching. If you know somebody that can benefit from this video, share it with them, like and subscribe for more, and we'll see you next time.